All right, so let's start out with the rib cage and the sternum and things like that. So we're going to start with looking at the sternum, and also, so we've got the sternum here, okay, and then we have the ribs attaching to it. How many pairs of ribs do we have, please? 12. What's the word for rib? Costilla, right? So we're starting numbering from superior to inferior. So first of all, please note that the blue structures here are cartilages. So if you're looking at the slide, true or false, no rib articulates directly to the sternum. No rib articulates directly to the sternum. That is true, because there's always, you've got the bone, the rib, right? We've got the cartilage, and we're going to the sternum. So there's always a little bit of cartilage in there. And let me ask you this. When you breathe in and out, does the rib cage expand? Absolutely, because the lungs expand and all of that. So you should note that there's little joints here between these costal cartilages and the sternum, and these are synovial joints, the little movable joints, except for the first joint, but we'll come back to that in just a bit. So looking at these ribs, you'll note that rib pairs, we're going to start superiorly, 1 to 7 are called true ribs, 8, 9, and 10 are false ribs, 11 and 12 get called both false and floating ribs. Now, why are the first 7 pairs of ribs called true ribs? I don't like that word because they're all ribs, right? Well, that's because they all have their own private costal cartilage taking them to the sternum. Check out rib 8. Here's rib 8, the rib, right? Check out the cartilage. Look carefully. Does the cartilage of rib 8 go straight to the sternum? No. It hooks up to the cartilage of rib 7. Cartilage of rib 9 goes to rib 8. Or, if that doesn't work for you, if this was a true rib, which it's not, it would have its own separate private costal cartilage taking it to the sternum. So this indirect attachment to the sternum by rib pairs 8, 9, and 10 gives them the name false. 11 and 12, look at that. Here's 11, here's 12. They don't even articulate to the sternum at all. They just kind of float there in space. Now, rib 1, I do want you to know is a specific rib type, but the others, on the other ribs, if I give you any other rib that's not rib 1, so, can I borrow a rib? Let me borrow a rib. I have a rib there too, so I'm sorry, I'm just trying to steal your rib. So if it's rib 1, please know it's rib 1, I'll tell you how. But on the others, if I give you a rib on a lot practical, I'll say, oh, this is rib number 7. Is it true, false, or floating? And the answer is true. Now it's switched. This is rib number 8. Is it true, false, or floating? That would be false. 11 and 12 would be floating. Rib 1 is a little small flat one, and I'll tell you how to identify that. Okay, but first we're going to go to the sternum, and that'll be your clavicle happening there. But on the sternum, so on the sternum, you've got this weird thing right here that has the costal cartilages in it, so this thing kind of looks like, I don't know. So we've got the sternum. What are all these things out to the sides? What are these representing? Costal cartilages, right? So we've got, one more time, got the sternum right here, and all these things are the cartilages. So there's no ribs here per se. So now going to the sternum, from superior to inferior, let me give you your sternum back, sorry about that. From superior to inferior, the sternum has 3 parts. We've got the manubrium, followed by the body, and down here you have the xiphoid process. Manubrium, body, and xiphoid process. So way up here on the manubrium, take a close look over here, you've got a little notch right here, and this is called the jugular notch. You could feel the jugular notch on yourself. Jugular notch is right here. Okay. Now, on either side of the jugular notch would be the clavicular notches. Take a wild guess which bone articulates to clavicular notches. The clavicles, and the clavicles are your collarbones, right? And then we have a joint. Listen carefully, it's going to be on the lab exam. The sternal angle right here is the joint between the manubrium and the body, right? It's a little joint. It's usually fixed. It's typically not a synovial joint. And this thing on the bottom here, this is the xiphoid process. And the joint between the body and the xiphoid process is called the xiphysternal joint. So again, from top to bottom, the sternum has the manubrium, followed by the body, followed by the xiphoid process. Okay? Now, the next slide should look kind of familiar because we talked about it when we articulated the ribs to the thoracic vertebrae. Remember, we found the head, neck, and tubercle is posterior. So on any big rib in the back, you have, remember, the kind of bumpy head, little constricted portion is the neck. What do you call the bump, please? Tubercle. So again, this side you have the kind of rough, bumpy, lumpy head followed by the neck. And what do you call the bump one more time would be the tubercle. Then on the larger ribs, make sure that you find, go ahead and grab, let's take a moment, let's get the ribs out. And also please find rib 1. It's a little small C-shaped one. Little tiny C-shaped rib. C-shaped, little tiny C-shaped. Find rib 1. No. Here's rib 1. You got rib 1. There we go. You got rib 1. Find rib 1. Yay! A little C-shaped guy.
You guys want to? Yeah, I would think so. Yeah. I was like, that sounds small.
Okay. All right, so you've got rib 1, which is good. But let's go back to the big ribs, right? Just make sure everybody understands on the larger ribs. In the back, you have here we go. We've got the head of the rib. We've got the what, please? The neck. We've got a little bump. Tubercle. Then don't forget the costal groove. This is important. Costal grooves always point down. Head, neck, and tubercles posterior. On the lab practicals, I will ask you right or left rib, and I'll come around and help you as soon as we're done here. But since you've got the ribs going on, go ahead and look at your rib 1 again. Rib number 1, little teeny tiny one. Rib 1. Again, we could identify things like, do you have rib 1? Oh, there it is, okay. So rib 1, perfect. So please find in the back, same thing. We've got the head of the rib. We've got the neck. What do you call the bump one last time? Rib, tubercle, boom. You go to the front, and what I'll ask you, if I go at the very tippy end, right here, I'll ask you what articulates here, and the answer is costal cartilage, right? And then one last time on articulation sites to the thoracic vertebrae. Remember we looked at this? Now we're going to look at this one right here. So remember that the rib head is kind of out of step with the thoracic vertebrae. What I do want you to know absolutely is that this would be the rib head, goes between the bodies of 2 vertebrae. It's not really clearly seen here, but the rib tubercle articulates to the transverse costal facet. Rib tubercle to the transverse costal facet. rib head between two vertebrae. So now let's go back to this one right here, which is clear or not, I'm not sure. So this is kind of superior view. And here, what I remember is the two T's, rib T tubercle articulates to the T transverse costal facet, wonderful. And the rib head goes on to the bodies of vertebrae, right between two vertebral bodies. Okay, so on a lab practical, this might be a good question. So if I give you a big old rib like this, if I have a sticker pointing to the rib tubercle, the question is, what articulates to the rib tubercle? Transverse costal facet. Or if I point to the rib head, what does that articulate to? The superior and inferior costal facets on the bodies of two vertebrae, okay? But the T is important to remember, transverse. Now we're moving right into the next part, and this would be pectoral girdle, clavicle, and the scapula. So let's go ahead and find go ahead and make sure you have a scapula and one or two clavicles. Either way might be good. Okay. All right, so first of all, make sure that you understand what the articulations are like. So medially, the clavicle articulates to the what? To the sternum. And laterally, the clavicle articulates to the scapula. Let's take a closer look at the clavicle. All right, so pick up a clavicle, pick up your favorite clavicle. You find one, there you go, here's one, here's the other. So first of all, make sure, that's a collarbone, make sure that you know it's a clavicle. That's the first thing to remember. So then we've got the clavicle, right? What I want you to know in the clavicle is the following. Obviously it has two ends to it. So here's the clavicle. Make sure that you could differentiate between the medial end, okay, and the lateral end. The medial end is the sternal end, and it's kind of chunkier. It's a little fatter. And the best way to remember the medial end, which is called the sternal, it's got a straight edge to it, straight sternal. It's chunky, but it's got a straight edge, right? And this medial end articulates to the sternum, right? Let's keep it quiet so we can go through it. Now, laterally, look at the lateral end of the clavicle. It's a little bit flatter, but it's rounded. And that's called the acromial end. So medial, straight sternal end, but chunky. And the lateral is kind of flatter and rounded. And that articulates to the acromion process. Okay, also make sure you find a little bump, which points inferiorly, and that's called the conoid tubercle. It might become important once we talk about muscles, and there's a little structure that goes through that as well. So please listen carefully. On the clavicle, this is important. I will not ask you right or left clavicles, because that's a lot, right? But I want you to know the following. Conoid tubercle, check, you found it? Little bump, right? Sternal end, please. Kind of chunky and straight edged. And the lateral end is kind of flatter, and it's called the acromial end for reasons that I'll tell you. All right, now please grab your scapula. Okay, so now we got the scapula going on. It's a good one. We'll come back to that. Yep. Okay, got the scapula? Okay, so now let's first look at the posterior view. Look at the back. So first of all, what can you find? Can you find the spine of the scapula? Everybody find the spine? Right? Listen carefully. Where does the spine point? Anteriorly or posteriorly? You could feel it. You could feel the spine of the scapula on your back, right? So then, on the spine of the scapula, if you kind of bring your visual, or just kind of keep going with the spine of the scapula all the way up, you're going to see the acromion process. Acromion means the highest point. You could feel your acromion process on your shoulder. Acro means on top. You go to Athens, you go see the Acropolis, almost means shoulder. So the highest point of your shoulder is the what, please? Acromion process. And the acromion process of the scapula articulates to the what? So that would go laterally, articulates to the clavicle, right? We'll try to put it all together. That's it. Yeah, almost the other way around. Medial. The other way around. Okay. So, also you could find a smaller process known as the coracoid process. It doesn't attach to another bone. There's a ligament attachment there to the coracoid process, which means it's supposed to look like the beak of a crow, crow's beak. So question, what is the definition or the word for a shallow depression? Shallow depression starts with an F, is a fossa. Fossa is a shallow depression. Okay, now, what would you call a fossa superior to the spine? How about the what? Supraspinous fossa. That one means this one, inferior to the spine, would be the what? Infraspinous fossa. So again, you find the spine of the scapula, supra and infraspinous fossae. And then, since you've got the scapula in front of you, you look at the anterior view, there's another fossa known as the subscapular fossa. Okay, so each scapula has 3 fossa: supraspinous, infraspinous, and subscapular fossa. Now, I just want to make sure that you understand how important the bones are, because once we're done with the first lab exam, the following week we're going to do the skull, and after that we're going to learn muscles. How many muscles do you want to learn? About 539? Yeah, okay. You just learned the names of 6 muscles. Did you know that? Have you heard of the rotator cuff? Right, rotator cuff. So the 3 fossa that we just covered in life contain muscles of the same name. So let's go back to this slide right here. Within the supraspinous fossa, let's make up a name of a muscle that is present within the supraspinous fossa. Supraspinatus muscle. What would you call a muscle within the infraspinous fossa? Make one up. Infraspinatus muscle. And within the subscapular fossa, subscapularis muscle. See? So there's 3 of them, of these muscles on either side. So we already learned the names of 6 muscles. So 6 down and 532 to go. Okay. That's part of the rotator cuff. No, this is going to be easy. Muscles you're going to love. All right, so let's hold off on this. So also we have borders. What would you call the lateral border? What would you call the medial border? Medial border. The lateral border is kind of closer to the armpit. Remember, naked person, make sure that you know them. What is the word for the armpit? Axilla, exactly. So lateral axillary border, medial or vertebral border, because it faces the vertebrae. Okay, then there's a little subscapular notch and so forth. Now, how do you know if it's right or a left scapula? What do you do? Well, we haven't covered this yet. There's a little notch called the glenoid cavity or glenoid fossa that always faces laterally because it will articulate to the head of the humerus. Okay, so you've got a scapula in front of you. How would you figure out right or left? Scapula. Try it on, see if it fits. Okay, so this is what I would do. All right, so here's the scapula, right? Find the spine of the scapula, right? Which way is it pointing? Posterior. Spine of the scapula is posterior. Glenoid cavity faces laterally, right? Try it on. This is the right one, right? One more time. The spine of the scapula is posterior. Thank you. Glenoid cavity faces out. Fits to the, there we go. How's that? Yep, there you go. Great.
Do you think it goes the clavicle goes this way or this way?
That's good. Yay! Yes, we're going to have to turn it over. A few more times. Okay. All right. Right or left? We're okay on the scapula? Right or left? One scapula.
Is that wrong?
One scapula. Oh, which one is that? That's right. Yep. Beautiful. Perfect. Right or left? We got that. Yeah. That work?
Really? This way?
And remember the spine is posterior. Turn around. Yay, perfect. Perfect.
Yeah. Yeah, because this has to
Okay, so now make sure you have a humerus, radius, and ulna. Run through all of that. That's it.
The flat part is on the inside of the or like where they go in front.
All right, so we need a humerus.
That's correct.
So this would be. But we haven't learned it yet, so we just switched up these guys. So this goes here. Beautiful. Yep.
Perfect. Oh, but we have it on the right side.
Yeah.
Okay.
Perfect. Okay, everybody's got a humerus.
It looks the same to me as it did before.
All right, so you should have two humeruses. Yeah. Okay.
I don't know, I was looking at like this part.
All right,
This
so
part
you've
is
got
like
radius and ulna.
yeah.
So please have the
I just looked where this one was going.
Alright, so radius, ulna, radius, ulna. Well, we'll figure it all out. Alright, so we're going to start with the humerus. Got the humerus going on. Alright. Alright, so we're starting with the humerus. Why is it called the humerus? It's a funny bone.
Funny bone.
But it humerus is means All right, so we're going to start proximal and work our way distally. Okay, please fill in the blank. So this will be a midterm question. The brachium is what's to the antebrachium? Brachium, antebrachium. Fill in the blank, please. Proximal. So brazo, brachium, antebrachium, and on the hand, what do you call the wrist bones? Carpals. Distal to that would be the metacarpals. What do you call these little guys right here? Phalanges. Okay, so one more time. The brachium is proximal to the antebrachium. Flip it upside down, fill in the blank, please. The antebrachium is what to the brachium? Distal. Fill in the blank, please. Regarding the hands, the phalanges are what to the carpal bones? Distal. Beautiful. Or the carpals are what to the metacarpals? Proximal. One more thing. The pollex is what to its fifth digit? You know, you don't trust me. Don't trust anything I say. Anatomical position. Okay, remember one more time. The pollex, don't forget anatomical. Pollex is the thumb. Pollex is lateral to its fifth digit. What's the word for the big toe? Starts with an H. Hallux. The hallux is medial to its fifth digit. So don't forget anatomical position. Okay, now we're starting with the humerus way on top. And first you're going to find a nice rounded head. Nice rounded head. Way up there's the head. And in the case of the humerus, there's not one but two necks. There is an anatomical neck, which goes right around the head, and that is like a little ridge, excuse me, which designates where that synovial joint capsule has attached to. It makes like a little ridge. That's your anatomical neck. So again, when you find the head of the humerus, look at the little line going right around the head. That's called the what? Anatomical neck. And down here it's called the surgical neck. Question, why is this called the surgical neck? Because if you're an orthopedic surgeon, you're making a lot of money over there. Why? That's where it breaks, right? Especially in a fall. What happens instinctively? Walk carefully. When you're about to fall, you're going to do what? Outstretch your arm. And that will cause this motion to happen. And two things might happen. You might break the humerus, fracture it at the surgical neck. So anatomical neck is going right around the head. Surgical neck is a little bit further down. It doesn't have like a line or anything to it, but it's kind of a little constricted region right here. Okay? Now, what is a tubercle? It's a small bump, and proximally, the humerus has two of these tubercles, greater and lesser tubercles. Greater is slightly bigger than the lesser, excuse me, the lesser tubercle is more medial. So again, we've got the rounded what head goes to the glenoid cavity. We've got anatomical neck. You break it where? At the surgical neck, and you have the two bumps, greater and lesser tubercles. Okay. Now, when you look at these bones, like the humerus, what kind of a bone is that? It's a long bone. So basically, we've got long bones. We've got short bones. Short bones would be the carpal bones and the tarsal bones. Then we have flat bones, would be like scapula, the ribs, and then we have irregular bones, like the vertebrae and stuff like that. It doesn't matter. But in a long bone, you've got the two ends, and the middle portion is called the body or the shaft of the bone. So you've got the proximal end, you've got the distal end, and you've got the body or the shaft. If you go around the midline, more or less, of the body or the shaft, you should see a slight little pronounced bump, and that's called the deltoid tuberosity. It's not going to be very clear. It's almost like a V-shaped on the thing. On the middle portion, it's not very clear. But the deltoid tuberosity, you find when it's not drawn, it's sort of like a V-shape. So take a wild guess. Which muscle attaches to the deltoid thoracic. Deltoid muscle. So we've got two more muscles in. So it's kind of a V-shaped bump. Right? Okay. Now, if you take a look at the distal end of the humerus, it all looks very nice and innocent, but it's a pain. This is a bunch of stuff right here. So now we're looking most distally on the humerus, and this distalmost region collectively is known as a condyle. Condyle means like a knuckle, kind of knuckle shape. There's two condyle-like things, but they have names. So most distally, you're going to see kind of a rounded condyle, rounded like a little head, and that's known as the capitulum. And then we have kind of a irregular thing right here, and this is called the trochlea. Capitulum and the trochlea. Make sure you find it. Now, immediately above the little head, the capitulum and the trochlea, we have the epicondyles, medial and lateral epicondyle. Find those epicondyles, please. Which one is bigger, medial or lateral? Medial. Okay. Can you feel it? Yes. Don't be digging around there too much, because you might hit the ulnar nerve. This is the funny bone. You know, if you hit your elbow just the wrong way, you know, they've got kind of a creepy, tingly thing. It's because you're actually hitting a nerve that goes right around that medial epicondyle. So, what's a fossa? One more time, please. It's a shallow depression. In the front, anteriorly, there's two fossa. Now, this is going to be a lot, but I'll come back to it. We've got the radial fossa and the coronoid fossa. One more time, two little fossa are in the front. If you turn this whole bone to the posterior, so now we're looking at the posterior and distal. Can you see one deeper fossa? And this is called the, what please? Olecranon fossa, right? So when you look at it, it kind of looks like an O-shaped O for olecranon fossa, right? So olecranon means the back of the elbow. Naked person. What do you call the front of the elbow? Cubital region or antecubital? Okay, and this would be the olecranon. So the olecranon fossa receives the olecranon process of the ulna. Okay, so now go ahead and try on your humerus. I will ask you right or left humerus. I'll come around and help you. On the lab practical, by the way, you can't touch anything, okay? Just visual inspection. So, the other way. Come around and help you. So I have pieces in. Discuss, please.
Which one?
Beautiful. Perfect. Yep. Okay, so on this one, don't forget we have one deep Okay. This will make even more or less sense. All right, so now we have the radius and the ulna, right? Fill in the blank, please. The radius is what to the ulna? Lateral, yes. Radius rotates around the ulna. So again, always in a comfortable position. The radius rotates around the ulna. Radius rotates around the ulna. Okay? So the radius is lateral, the ulna is medial. Okay, so now we're going to, let's go ahead and just pick up just the ulna. Just the ulna. So you know what the ulna is? That's a fibula. We don't need that. All right, so on the ulna, let me steal your ulnas, right? Perfect, thank you. So we got the radius on the ulna. So on the ulna, we've got a notch. Find the notch on the ulna, right? So we're just looking at the proximal end. Just the proximal end. So ulna has like a little U-shaped thing right here. You got the ulna? Okay, now what do you call that notch? Trochlea notch? Does the word trochlea sound familiar? Yep, because a trochlea notch goes around the trochlea of the humerus. Okay, now if you take a look at that U-shaped notch, okay, we're still on the notch. Right here, that's a notch. You have two ends to it. Over here, please listen carefully. Let's keep it on the down low so everybody could hear, and then we could talk until we can't talk anymore. So this would be the olecranon process, and this is the coronoid process. Olecranon process and coronoid process. Can you find your olecranon process on your person? Exactly right. You bend your elbow. You feel that bump right here. This is the what? Olecranon process. When you flex. What happens to the olecranon process when you extend? Where is it going? Into the olecranon fossa. Olecranon process fits into the olecranon fossa, right? So process extends, fossa recedes, right? Also, you have this process, that's the coronoid process, and the coronoid process fits into what fossa? Take a wild guess. Coronoid fossa. And that gives you this flexion and extension. The next part is super important because I will ask you right or left, ulnas, radius, and all that. So if you take a look at the proximal portion right here, we've got the olecranon process, we have the coronoid fossa, a process. Look immediately lateral to it and you find a little notch. Please find it. This will tell you a lot about right or left. It's called the radial notch. Listen carefully. It's on the ulna, but it's called the radial notch. And it faces laterally. It faces out. Radial notch faces out. And it recedes the head of the radius. Okay? So if you're trying to figure out, that would be on the other side, right or left ulna, what do you do? Well, what you would do is, Alright, so this is how you know. So you've got the ulna going on here, right? You've got the notch. What do you call this notch, please? Trochlear notch. The one on top here starts with an O. Olecranon process, and this one is the coronoid process. And you find the radial notch, little notch, right?
This right here.
Radial notch faces laterally. Try it on. If it's on your left, it's a left. The radial notch faces out. Trochlear notch looks like a big mouth, faces anterior. Okay? Don't forget the ulna is medial. All right? Perfect, you got it.
Wait, so like this? Wait, this. Yeah. Okay.
I'll go around and help you with everything as soon as we get an elbow going. One, okay? All right, so a couple more things on the radius and the ulna that I'll ask you about. So here we go. How do these bones articulate? Well, there's two joints, one on top and one on the bottom. So when you look way up here, this joint between the head of the radius and that radial notch is called the proximal radial ulnar joint. Easy. If this is the proximal, what would you call this one down here? How about the distal radial ulnar joint? Okay, proximal and distal. Now, on the radius, look for the following things. On the radius, now the radius has a round head, okay? And look at the slide. Which bone, radius or ulna, flares towards the inferior? Which one gets bigger? Distally would be the radius. It gets bigger, right? But take a look at both the radius and the ulna. Most distally end up with a sharp-ish process known as a styloid process. So both radius and ulna distally end up with this sharp thing known as a styloid process. You can find your styloid processes on yourselves. Feel these little bumps on either side of your distal antebrachium. These little things right here would be your styloid processes. Before you get to the wrist, styloid processes, muscle attachment sites, very, very important. Now, on the radius, how do you know right or left? And I will ask you that. If you take a look at the radius, first of all, the radius is lateral. So that means that the styloid process is lateral. But then this is what you look for. Distal anterior radius. Remember, it flares out. It's smooth in the front, but in the back it's notched. Smooth in the front. So whereas the posterior has these little notches. Okay? So take a look at that. See if I'm telling you the truth. And look at the posterior. Okay? Can you see that? And at this point, go ahead and put an elbow joint together. So your next assignment, and I'll come around and help you, you're going to get a humerus, radius, excuse me, radius and ulna, put them all together to form an elbow joint. I'll come around and help you. Right, so we've got the humerus. Yeah, we'll keep on work on that.
Maybe they need to switch. So this one's designed. That's the back. This is the back view. So we'll go. This is the front view. And then no, that's right. That would be the back view. Right. Does that look right from the back view?
Which one is the right body?
See how this?
So this would be posterior.
Yeah. So together, that because they connect at the bottom like that, right?
So if you were to like flip them over, that would be anterior.
What is that? See, this thing points like yeah, so that's right.
Okay, got it. Let's get some humorous section.
This I mean, it looks better than this.
No, wait, I think that looks. Yeah, these ones go together with that. Okay. Oh, you're trying to do it on the opposite side. That's fine. Let's see.
Oh, because this goes on the inside.
That. Right, yeah. Because your ulna is going to go on the most outside. The radius is going to go on the inside. When we're looking at it forward, does that make sense? From the anterior position? This is the posterior. Yeah. Yeah.
This is the ulna.
So this goes on the outside? The picture that she shows us is the left one? Yeah. Wait, no.
Perfect. There we go.
Oh, yeah, look, sorry, I don't know my last mind. The picture.
Ooh, okay, was that fun? How's it going over here?
Is this one the left one up here?
Let's see, we got that. Okay, so we got this. What are this one? So like this. And like that. Beautiful. Look at that. Ooh, you bend and you bend.
Okay.
Yeah. How's it going?
That goes there.
Alright, so the other thing you might want to do is
Why am I lost?
That makes sense because it's coming out.
what is the head of the radius? Here's the head of the radius. What does it pivot around? The capitulum. So head of the radius. Talk to me, head of the radius. Head to head to the capitulum, right? And once you bend your elbow, the head of the radius fits into what fossa? Radial fossa, right? Whereas when you bend your elbow with respect to the, you don't need to, oh, you're missing. Okay. So on the ulna, what do you call this big bump over here? So let's bring that over. Olecranon process fits into the what? Olecranon fossa, right? Ooh, okay. Olecranon process fits into the olecranon fossa. When you bend your elbow, what happens, please? See what? Process fits into the coronoid fossa. One more time. Olecranon process fits into the olecranon fossa. Coronoid process fits into the coronoid fossa. Right? Just like that. Okay. Easy. We'll come back to that. We'll have some time to look at it. But now we're going to look at this slide right here. Okay. So you have this light, so this makes sense, right? So if you look at the anterior view, right, you've got the head of the radius, look carefully, head of the radius, pivots around this little head capitulum. Capit means head, you go to the Capitol building. Capitulum means little head, listen carefully. You go head to head, head of the what? The radius over the little head capitulum. And when you bend your elbow, the head of the radius fits into the what? Radial fossa. One more time. Head of the radius pivots around the what? Capitulum, which means little head, and ultimately fits into the radial fossa. Easy peasy. Now, this would be the coronoid process of the ulna. When you bend your elbow, it fits into the what? Coronoid fossa of the distal humerus, right? You turn this thing around and you look at the posterior view. Check this out. Look at the posterior view. What do you call this big bump right here? olecranon process. When you extend your elbow, check this out. So here's your olecranon process, right? Here we go. If you want to follow along, you go like that, right? And when you extend your elbow, where's it going? Into the olecranon fossa. The process it sticks out fits into the fossa of the same name. That's your hinge joint, flexion and extension. Okay? So again, here's the olecranon process and fits into the olecranon fossa. Midterm question, fill in the blank, please. First of all, what do you call the front of the elbow? Antecubital region. Ante would be the front of the elbow, antecubital region. What do you call the back of the elbow? Starts with an O, olecranon region. Please make sure you know naked person inside out. Fill in the blank, please. The olecranon region is what to the antecubital region? Posterior or dorsal. Or flip it around, you can say antecubital region is what to the olecranon region? Anterior, what's another word for anterior? Ventral. See? Okay. And then finally, let's look at the hands, and I'll try to help you with everything. So we only have, I think you'll have one hand in your collection. It's probably not even a very good one. But on the hand, we'll always look at the anatomical view. The hand has been fractured. Sorry. Okay. All right, so on the hand, I know we're missing fingers, usually the middle finger is missing. Okay, we're missing a couple of them. All right, so on the hand, it will be an anterior view. So we're going to start, on the lab practical, by the way, on the lab practicals, you can't touch anything. But I'll tell you, on the hand, it will be an anatomical position. Okay, so we're going to start proximally right here. What do you call these bones, please? Carpals, right? Carpal tunnel. Distal to those you would have the what? Metacarpals, beautiful. And most distally have the phalanges. So one more time, we've got carpals, metacarpals, and phalanges. How many carpal bones do you have per wrist? How many carpal bones per wrist? 8. Do you need to know all of them? Yes. So we got 8 carpal bones. You need to know all of them. Here we go. So they're sort of arranged into 2 rows of 4 each. So we got, and I gave you the different colors. So we got the proximal row of 4, and we've got the distal row of 4. 4 plus 4 is 8. We're going to start proximally. We have this kind of elongated bone, that's the scaphoid. And then there's like a little half moon, that's called the lunate. Then we got this one, and nobody could say, triquetrum, which means triangular. And then finally, my favorite bone, I love this one. It's the pisiform. Isn't that cute? It's a little round one, and I love it because it's an independent bone. It grows in its own little tendons. So the proximal row, we've got the scaphoid, which is elongated. Scaphoid means boat. So we got it's very romantic. We've got the boat. You're sitting in a boat. You're looking at the moon. I don't have a story for this. But triquetrum means triangular. When I was at UCSF, it used to be called the triangular bone, and everybody was happy. Then they decided, no, it's not anatomically sounding enough, so they decided to change it to triquetral, and now it's called triquetrum, which means triangular. Dumb, right? What's my favorite bone, please? Pisiform. So go, again, you're sitting in the boat, scaphoid, you're looking at the what? Moon. I can't say this one. Yeah, and my favorite is the pisiform. The distal row would be the following. We've got the trapezium, we've got the trapezoid, capitate, and hamate. What is she talking about? So, trapezium and trapezoid, don't they sound the same? I'll tell you how you'll never forget the difference. Y'all ready? Trapezium is on the thumb. thumb. So next to it would be the trapezoid. The capitate, capit means head, is the largest of all of them. Kind of has a roundish head. And hamate has a hook on it. You could feel the hook of the hamate on your pinky side. So hook of the hamate. So again, distally, the 4 bones would be what? What do you have on the thumb? Trapezius. Next to it, trapezoid, big head. Yeah, and who's got the hook? Hamate, right? So I'll help you with all of those as well. Now, distal to the carpals, we have metacarpals. How many metacarpals do we have per hand? That would be 5 because we've got 5 digits. And here we're just going to give them numbers. What do you call the thumb is called the what? Pollex, or the first digit. Associated with that would be the first what? Metacarpal. This would be what? Second metacarpal, third metacarpal, fourth and fifth metacarpals. The law of practicals are multiple choice. And you know how mean I am. One of the choices might be metatarsal. Don't go there. Toes tarsals, that would be within the foot, right? All right, I'm kidding. But no, not really. Okay. So what do you call these guys right here, please? How many phalanges do we have per hand? You sure? Keep counting. 5 was not enough. 4? No. 14! Yes! Why not 15? Look at the pollex. How many do we have here? 2. All the others have 3. All the other fingers or digits have 3 phalanges. So let's look at the name. So phalanx refers to a row of soldiers. Like if you look at World War I or Civil War, soldiers would line up in rows, right? So 1 phalanx, 2 or more phalanges. And this is how you name them. I will ask you to name them. So this is a second digit, right? So this is called the proximal phalanx of the second digit. What would you call the middle one? Middle phalanx of the second digit. And what do you call this one? Distal phalanx of the second digit. So listen carefully, or let me ask you, which digit does not have a middle phalanx? The thumb, the pollex, right? So on the pollex, so this would be the first metacarpal. This would be the what? Proximal phalanx of the first digit. This would be the what? Distal phalanx of the first digit. There's no middle. So one last thing, let me ask you. So lab practical of the hand will be in anatomical position. Remember, lab practicals, you can't touch anything, right? Can't flip this thing around. But I'll tell you right now, the hand will be in anatomical position. Other bones may or may not. So I have a hand for you, and I have this thing labeled. What is this, please? It'll be multiple choice, but let's just do this one. What is this? Proximal phalanx of the 4th digit. How about this one? Distal phalanx of the 5th digit. How about this one? 3rd metacarpal. How about this one? Proximal phalanx of the pollex or of the first digit, doesn't matter. And this would be what? Distal phalanx of the first digit or of the pollex. There's no middle one. Okay, folks, sorry I went fast, but I know it's freezing, so I wanted to get all this information out to you. I'll come out and help you with everything. Don't leave because I'm here. You could leave if you feel uncomfortable and it's freezing. I understand that. You come over here and kind of warm up your digits. All right. So next week, I know, we're doing the lower limb and the pelvic girdle. We're looking at some pictures. Cytology micrographs are back for you to look at. And I'll come around and help you with everything. Okay? All right.
Yeah.